Can a tracheostomy prevent aspiration? That is one of the many questions we're getting quite frequently from families in intensive care, and I'm going to answer this question today. My name is Patrick Hotzel from intensivecarehotline.com, and this is another quick tip for families in intensive care. So can a tracheostomy prevent aspiration? The answer is that a tracheostomy does not inherently prevent aspiration. In fact, many patients with tracheostomies are still at risk for aspiration, especially if they have issues with swallowing, dysphagia, or impaired neurological function. So what is aspiration? Aspiration occurs when food, liquid, saliva, or gastric contents enter the airway instead of going down the esophagus to the stomach. This can lead to aspiration pneumonia, which is particularly dangerous in medically fragile patients. So how a tracheostomy affects aspiration risk? A tracheostomy tube creates a direct airway through the neck into the trachea, bypassing the upper airway structures like the larynx and vocal cords. This can sometimes reduce the sensation in the upper airway, affecting the swallow reflex, make it harder to cough or clear secretions effectively, especially if the patient is weak or neurologically impaired. Aspiration may worsen in patients with poor swallowing function, neurological injury like stroke or hypoxic brain injury, weak cough reflex, significant secretions that they cannot clear. Exceptions or modifications. Some tracheostomy tubes are fitted with cuffs, inflatable balloons around the tube. A cuffed tracheostomy tube, when properly inflated, can reduce but not fully eliminate the risk of aspiration, especially of large volume secretions. However, it does not stop microaspiration, which basically means it's minimal aspiration of secretions from the above cuff. Long-term cuff inflation can damage the trachea and does not eliminate the risk. Swallowing therapy, diet modifications, and sometimes speaking valves, like a Passimure valve, may be used in tracheostomy patients to help reduce aspiration risk as part of a broader care plan. In summary, a tracheostomy is not a guaranteed way to prevent aspiration. It might help in some specific cases, i.e. to manage secretions, to reduce large volume aspiration temporarily with a cuff tube. But managing aspiration risk requires a multidisciplinary approach, including speech therapy, nutrition, and respiratory care. So there you have it, whether a tracheostomy can prevent aspiration or not. I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years, and I've been consulting and advocating for families in intensive care since 2013 here at intensivecarehotline.com, and I can very confidently say that we have saved many lives for our clients in intensive care. And you can verify that by looking at our testimonial section at intensivecarehotline.com, and you can verify that on our intensivecarehotline.com podcast section where we have done client interviews. Because our advice is absolutely life-changing, right? The advice and advocacy that we're providing is so life-changing that, like I said, we have saved many lives and we're improving the lives of our clients and our members instantly so that they can make informed decisions, have peace of mind, control, power and influence, making sure their loved ones get best care and treatment always. And that's why you can join a growing number of members and clients that we have helped over the years, once again, to improve their lives instantly, making sure they can make informed decisions, have peace of mind, control, power and influence, making sure their loved ones get best care and treatment always. And that's why I do one-on-one consulting and advocacy over the phone, Zoom, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I handhold you through this once-in-a-lifetime situation that you simply cannot afford to get wrong. And when I talk to you and your families directly, I also talk to doctors and nurses directly, and I ask all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I talk to doctors and nurses directly, either one-on-one, or I have you on the phone with them, or I'll set you up with the right questions to ask. I also represent you in family meetings with intensive care teams so that you can have clinical advocacy and representation on the family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time We also do medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. We also have a membership for families of critically ill patients in intensive care, and you can become a member if you go to intensivecarehotline.com, if you click on the membership link, or if you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in the membership area and via email, and we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I've personally written and recorded. And all of that, once again, will help you to improve your life instantly so that you make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, share the video with your friends and families, comment below what you want to see next, what questions and insights you have from this video. I also do a weekly YouTube live where I answer your questions live on the show. And you will get notification for the YouTube live if you're a subscriber to my YouTube channel, or if you're a subscriber to my intensivecarehotline.com email newsletter at intensivecarehotline.com. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.